you. Much appreciation to you all. So we're going to just go over a bunch of things this call, and we're going to try to get out of here at around 4:30. Just a reminder that we do record these calls. They will be followed up in PH Partnership Bulletin with a link to this PowerPoint, as well as the YouTube link to this recording. If you do have any questions, please do not hesitate to message me directly, put it in the group chat, or come off the mic and ask your question. So some of the things we're going to be covering are cold, flu, general public health updates throughout the county. So again, we're doing this for you all. So if you have any questions or recommendations, please don't hesitate to stop me midway. All right. I kind of wanted to start it off just a little bit light here, just to remind folks what we got going on in the middle of February. So Seattle King County is throwing on a clinic. It's a free health clinic. It runs from the 15th to the 18th of February. It's going to be pretty much near the Seattle Center here. A lot of great resources, a lot of great free healthcare. The next page, I'm going to show you some of the type of things that are provided there. But it is a first come, first serve basis. One big important thing about this free clinic is no ID is required, meaning it is open to everyone. So if you work with clients, or you yourself perhaps like to take advantage of this and you need more questions, please don't hesitate to reach out to me. The screen seems dark. Let me try this. Did that look better for you, Janelle? Or is anyone else seeing a dark screen? All right. Well, I'll keep going, but
it could be my screen. Don't worry about it.
Okay. Yeah, no worries. But if anyone does have any questions about this clinic, please don't hesitate to reach out to me. It happens about twice a year. Again, it is a wonderful time. It gets really busy over in the Seattle Center. Parking is a little bit tough, but there's a lot of transportation to and from this event. You have the Seattle monorail, ample amount of buses coming to and from. But I'm just going to read off a couple of the things that are provided at this free clinic. So we got free dental, vision, and medical care. The way that this works is there is a limited amount of admission tickets. So by the time it opens, you're going to have people waiting in line to get some of these tickets to the event so that they can get in and, access the care. You cannot get both dental and vision on the same day. Those are some of the high ticketed items, if you will. So if you come in on the Saturday and get dental, the next day you're going to have to come in and get your vision on the next day, which would be that Sunday. The times are, the times start at 5:30 in the morning is when they're going to start handing out tickets. And I believe the event runs from 7 a.m. until 5. I will get back to you on that because I don't see the time printed on here, but perhaps before the end of the meeting, I'll have exact dates and times. If not, I will follow up in the bulletin. But we have dental, vision, medical. They're going to have physical exams, x-rays, mammograms, ultrasounds, and, blood tests, STI screenings. But again, this is coming up in mid-February, so we do have some time to prepare, especially to get the word out to your community. So if you have any questions, we can direct that to myself. And at the end of this PowerPoint, my email is on the last slide. So yeah, and to answer one of the questions in the chat, I will get the exact times for you, my friend. So I apologize for that. All right. The next slide, we've been in the middle of a cold snap right now. We haven't experienced some of the massive snows that we've been seeing, nationally, but we have our own weather issues currently going on right now. It was absolutely freezing in this last week. We are still in a weather emergency right now, which means that we have shelters open 24 hours. This link, when I send up the PowerPoint, is going to open up to a bunch of cold shelters in the King County and Snohomish counties, where you'll be able to access resources. And then on the next page, when you go to the King County Regional Homeless Authority website, it's going to kind of lay out what we're experiencing currently in King County. So just to give a kind of snapshot of what we're kind of going through right now, we have overnight freezing temperatures in the forecast, which means that we are a tier 3 severe weather response protocol. So what this means is essentially that we are opening up, 24/7 emergency shelters throughout the city. So once you go to the King County Regional Homeless Authority webpage, you will see down there, you're going to get a list of Seattle, North King County, so on and so forth. You just, click the region that you want, and it's going to list all the 24/7, all the partial opens, like at libraries where they're doing shelters. So definitely a great landing page as we're in the middle of the winter season. This also is in response when we have heat waves in the summer, but for right now, this is a good resource for folks not only experiencing, homelessness, but we're also seeing folks losing power throughout this time as well. So a great resource to share. And again, if there's any questions, feel free to ask them in the chat box. We're just going to be going through this PowerPoint rather quickly as there's kind of a lot to talk about here. All right. I just experienced the cold and the flu for the past 2 weeks. It seemed like it was never ending. But that is common at this time of year, and it's common right now in King County. We are seeing an increasing number of visits to local emergency rooms for cases of the influenza, the flu. We're seeing, rises in RSV, a little bit of rises in COVID-19, and definitely with the seasonal cold as well. So this webpage that we have on your screen right now links you to the Public Health Insider, and there it's going to lay out, how to prevent illness this cold and flu season. So some tips, wearing a mask. We heard that a lot when it came down to COVID-19. But by doing so, it's preventing those airdrops and, keeping yourself safe and keeping those safe around you, especially if you are sick. Improving the indoor ventilation of your house is important. It's cold right now, so a lot of heat and moisture is getting trapped into homes. So we want to just make sure we do have some airflow going in there, which is definitely healthier for the body. Having a good filtration system. A big one, washing the hands. I don't know if it's listed on this page, but washing your hands is going to do wonders every time you leave the restroom, anytime you cough, eat food, touch food. You want to be a little bit mindful. And if you're sick, we want to stay at home. Everyone I can confidently say around here probably knows someone who had the cold or the flu in their family, if not personally this season. I feel like it's been a little bit extra. It's taken me down, but there are things that we can do to mitigate it. And we're going to talk a little bit later about flu vaccines and some of the case counts that we're seeing here in the county as well. So where to get the flu vaccine? So healthcare providers is going to be, a great spot for you to get the vaccine. That can look like a CVS, a Walgreens, CMAR, a doctor's office, Kaiser, Swedish Medical Center, and kind of the list goes on. We do have our public health centers as well, which offer, the Kent Public Health Center specifically offers the flu vaccine if you get the COVID vaccine at the same time. Some of our school-based health centers are still offering the flu vaccine for individuals. They've been pushing this flu vaccine now on us for, I think, about, what are we at, 4 or 5 months now? So we're not at the tail end of it yet. So we're still, getting the messaging out, to get vaccinated for the flu. You can go to Vaccine Finder, which is a link on this webpage as well. And when you go to the Vaccine Finder, you'll be able to select, you're looking for the COVID vaccine, you're looking for a flu vaccine, and many other vaccines there. You can combo them all, or you can just look specifically for the flu vaccine, and that's going to list all the vaccines locations in your area. So definitely a lot of choices out there. And I know not everyone's medical insurance covers the flu vaccine. Most do. For most individuals who have insurance, the flu vaccine is going to be at a low or no cost. And then a little bit later, we're going to talk about for individuals who don't have access to healthcare or had limited access to medical care as well. So let's keep going. So this one is always just a little bit daunting to look at sometimes, but I think it's important for us just to kind of get a visual of where we are. So this link and this, it's rather small, so I do apologize. But this dashboard is really highlighting COVID-19, influenza, RSV in King County. There's a couple other that you'll see on this dashboard as well. But really, if you want to take a look, what we really see in King County this year or in the past 4 or 5 months, the rhinovirus, which is the common cold. So we spiked. I think that is I can't click on the link, but I think that's way back in October. And as we kind of got to the end of the year, the last update was on December 30th. And from there, we are seeing we've kind of maintained. The cold is still going around. 2 up from that, influenza. We started off really low and we're kind of, building our way up. Hasn't been updated really since the new year. But you just know your loved ones around you who have been sick and how this can kind of affect the data as well. So another important thing about our dashboards, especially this one, this is going to be confirmed cases. So what was new to me recently is I went into my doctor's office and I got a COVID test, but it also was a test for the cold and the flu. So when I got my results back, I had, 3 different tests and they came up as they came up. But I've never seen the cold and the flu tested the same way they did COVID. So I learned something there, but these results are very reflective of that. They're not, oh, I think I have the cold or I think I have the flu. We're not getting data that way. We're getting data from specific tests and results that are getting sent to the Department of Health. So the numbers may look a little low here, especially as we look at the influenza, and we may think that that's a lot higher. And I will agree with you that they are definitely higher. But again, these are test results that have been reported to the Department of Health. All right, and now to the stuff that kind of started this meeting. Where are we at with COVID? So COVID-19 in King County, Washington, our current level right now is low. We have been low for almost a year. We've been low for a long time. We could equate that to the amount of individuals who have been vaccinated, who've got the updated booster, or even the new vaccine that just came out in September. So we've maintained a low status. The reported cases in the last 28 days have been 91. Hospitalizations due to COVID-19 have been 10, and then deaths have a statistic of 0.4. Again, just like the dashboard we just looked at, it is from cases that are being reported and sent to the Department of Health. This could be from an at-home COVID test that you test positive and you want to report that case to the Department of Health, or this can be from going to your doctor's office where they, would then send that positive test result to the Department of Health for us to get our data. So again, it is very reflective of that. It doesn't capture individuals who may test positive and not report it, because I believe that a lot of us are on that wavelength right now. And that's what, that is not what is captured here. So I just want to call that out for what it is, because there's just a lot of, everyone's talking, everyone feels like everyone has COVID right now. Everyone has the flu. And that's just, I think the time period that we're in the winter, it's cold, folks are getting sick. We have a hard time differentiating from the flu and COVID. And, we're just not seeing the data reflective of our loved ones around us who are, sick right now. So we have to take this a little bit with a grain of salt, but nonetheless, we are low. We have been low, and that is a positive note for the job well done at King County. And it's literally in response to all the work that folks like you have been doing, getting the messaging out, keeping safe, wearing masks, and taking information from public health, from the Department of Health, from the CDC, and getting that back into community. So I guess kudos to everyone. You've done a pretty remarkable job here. All right. So the new COVID-19 vaccine for 2023, 2024. This is messaging that I know you've heard of in this call. I don't know how many folks who haven't been on this call before, but we're going to kind of just talk about it again. We haven't met in a couple months. But back in, September, I believe, we had an annual booster that was made available. It's made available in the fall. And because of these boosters, it allows for updates based on circulating variants. So a big one with this new COVID vaccine that we saw last year around September was the Omicron got thrown into that variant. They provide extra immunity protection, especially those who are at, the highest risk populations. It was approved back in the fall, and the messaging that we provided and still are talking about is everyone 6 months and older should get this new COVID-19 vaccine. It's important for older adults. It's important for the high risk populations. And I think I saw a stat today, and I don't have the number, but in King County, we have, I think it's 28% of individuals, 465,000 folks in King County have got the new updated COVID-19 vaccine. I don't know the number of percent that is, but I can confidently say it's 400,000. It's below 500,000, but that is how many folks have been who have received the new updated version. This is also important to know. The older versions of the COVID vaccines, whether that be Johnson & Johnson, Moderna, or Pfizer. With Moderna and Pfizer, there was the first dose, the second dose, and then we had boosters that followed it. With this new vaccine, it is a one shot. It is a one dose. If this is your first time to getting vaccinated for COVID, you will only have to do one dose. That's the same for Moderna. That's the same for Pfizer. This allows, families to not have to take off 2 days of work. It allows for folks not to get sick, twice from the vaccine. So, sorry, I got just distracted there for a second. So I got messaged on Teams. But it is a one dose. It's a one and done. And that is going to be the dose moving forward. The old vaccines, the old COVID vaccines are out of circulation. They're not manufacturing those anymore. And we're just sticking with this new one that got released in the fall of 2023. So we just kind of talked about this, but what is the new vaccine? Is it worth getting? And it is, it's going to strengthen your body's ability to fight the new variants. We haven't seen in 2024 a new variant really, hit the news or make its way through the nation yet. But if we do, this is going to help build us that immunity. It's going to help keep us fresh. We're kind of looking at this like the flu vaccine that we get on a yearly basis. So by getting this vaccine back in September, the fall, or whenever you may got the updated COVID-19 shot, you're just helping your body prepare for what's to come if you do come in contact with it again. So studies show that, keeping up to date protects people from long COVID. Long COVID includes long-lasting symptoms, difficulty with thinking, difficulty with breathing, headaches, and extreme tiredness. Anyone can get long COVID, even if you're not in the high risk group. So the new vaccine, it protects everyone. We at the start, we were very much messaging the high risk populations, but we want that messaging to be known that anyone over 6, can get this new COVID-19 vaccine. And then I'll go a little bit more into detail here, and then we might, I guess actually I have a question for folks. If we talk about the vaccine that got released in the fall, maybe just a couple, is this useful for you? Throw a thumbs up if it is, to talk about the vaccine, or are we kind of overhearing about this? Because we kind of do it every meeting. Just kind of curious if anyone wants to share their thoughts on that. Okay. I see a thumbs up, and that is enough for me. So appreciate it. All right. So the vaccine, for COVID vaccine appointments, again, we're talking about, vaccines.gov. This is a great landing page for all vaccines, but we're going to be very specific about COVID right now. We're going to show on the next page, kind of walk you through a little bit of the steps, but the vaccines.gov is going to really highlight pharmacies and clinics that have that new vaccine for you. And then you just go and you book that appointment. One of the things, if you are a Kaiser member, for folks that know Kaiser, that is pretty exclusive to their facilities. So this is more specific to pharmacies and clinics versus Kaiser. So just be mindful if you are dealing with community who has Kaiser, that we want to, push them towards that Kaiser direction, because the cost of this vaccine can be a little bit pricey for individuals for sure. All right. So, all right, the next page, we're going to kind of do a little walkthrough, but where to get vaccinated. So we talked about it, but pharmacies, healthcare providers, community health centers, children and teens, this is really important as well. So anyone under the age of 19 can get a no-cost vaccine. We'll never have a price tag around the COVID-19 vaccine if you're under the age of 19 in Washington State. So providers in the childhood vaccine program, they're listed there with specific locations, school-based health centers. And then also we have mobile vaccine clinics for children in the South King County area. I know I talk about a lot about the links that are being posted here. It's just hard for me to click them and kind of, go through the map of it, but this will get into your hands when this call is done, and you'll be able to have all these links ready for you. So outside of children and teens, it's important to also talk about the uninsured and the underinsured adults. So they will be able to get no-cost COVID-19 vaccines with something called the Bridge Access Program. The next slide, we're going to kind of talk about how to navigate that. The Bridge Access Program at first can look just a little bit confusing. It's a two-layered approach. But with the Bridge Access Program, the government partnered with CVS's, Walgreens, and very few limited independent pharmacies. I can't speak for who those pharmacies are off the top of my head, but I will say that the CVS and Walgreens, they are nationwide, and they offer free COVID vaccines for uninsured and underinsured adults. You just have to click this Bridge Access Program link when you go to vaccines.org. So the next slide, we're going to kind of walk you through that. So this is why I say it's kind of a two-layered approach here. So the Bridge Access Program is something that you're going to locate on vaccines.gov. So the first thing you're going to do is you're going to hit find a COVID vaccine near you. You hit that button, it's going to take you to another page or perhaps a little drop-down menu. It's going to ask you for your zip code. So we'll type in 98004. And then whoa, which way are we going? Okay, sorry, team. You're going to drop down a little bit below after your zip code, and it's going to ask you for Moderna, Pfizer, which are the COVID vaccines. You can click, if you just want Moderna, you can click if you just want Pfizer, or you can click both. We do have a lot of Pfizer in King County. Moderna is a little bit harder to find. So Pfizer is definitely one that is in a lot of pharmacies right now. Just for the story, we'll click both of them. And then the next step is going to take you to something that says appointments available, ability to vaccinate, all surge vaccines. And the final checkbox is going to say Bridge Access Program. This is important to click that Bridge Access Program little checkbox there, because what that's going to do is it's going to eliminate every other pharmacy where you're going to have a cost for the COVID vaccine. So if you're looking for a no-cost COVID vaccine for folks that have no insurance or underinsured, clicking that Bridge Access Program, I think it's, again, one step, two step, the third step, clicking that, it's only going to list you those CVS's, those Walgreens, and then you're not going to have a cost when it comes time for you to get that vaccine. So that's just the important little piece that I just want to remind folks of. it's a little bit of a digital access barrier that we are seeing, but it can be done. So also, if there are any questions, we have a fantastic team of vaccine supporters here at Public Health that can help answer any of those questions for you or help navigate any language needs as well. So on this vaccine.gov website, you are going to see a drop down of many different languages. I'm going to go with, I think, 9, possibly 7 or 9 languages where that landing page is going to be translated. But what happens sometimes is when you click CVS to go book your appointment, CVS is not going to translate into Spanish, or it's not going to translate into Somali. So what you may have just translated the whole web page in Somali, once you click CVS, it doesn't integrate. But we have people on our team that can help facilitate that, whether it be interpreters or a Google Translate function that we can kind of tap into. We have community health workers as well that can help navigate these things. So just don't want this to be a barrier for folks. And if you're hearing it in the community that it is a barrier, please don't hesitate to reach out and let us know. Feedback is great, so we can help mitigate these issues. So I think that's it for COVID vaccine. Just going to do a cute little time check. I guess a little bit more information, but Public Health Center. So we have a Public Health Center in Kent. On October 3rd, they started offering the new COVID vaccine. They also offer the flu vaccine there for folks that are getting the COVID vaccine. It's a community event. So they also do in-home vaccinations that you can call as well. It's going to be on the kingcounty.gov/vaccine to kind of set up an in-home vaccination for whatever reasons that you want to get vaccinated in home. So a lot of things happening internally and externally, but the Kent Public Health Center, which I believe, didn't highlight that, but the Kent Public Health Center is a great public health center that we're still offering like a mass vaccination site that, we kind of did in 2020, 2021. So if you're in the South King County area and you don't have time to go to vaccines.gov, the Kent Public Health Center is going to be a great resource for you and your community. So talking about the financial part of COVID-19 vaccines, so we kind of addressed, whether you're uninsured or you have limited access to insurance, but most insurances, companies are going to pay the whole cost of the COVID-19 vaccine. So that's going to include Medicaid. It's going to include Medicare, which we know as, or Medicaid, which we know as Apple Health. So you will need to get vaccinated by a provider in your insurance's network. A lot of vaccines on vaccines.gov will be included most likely in your insurance, especially if you have Medicare or Medicaid. It's going to be included in that vaccine.gov. It's very inclusive to just a lot of providers. The only one I said is going to be Kaiser. You just want to be very mindful if you have Kaiser to please only locations, because the cost of the COVID-19 vaccine can be a little bit pricey if insurance doesn't pick it up. So, all right. So we talked about this. I'm not sure why I included it, but getting the free vaccine using the Bridge Access Program. Children and teens who do not have insurance. We mentioned this. Anyone under the age of 19 can get a free vaccine, free COVID-19 vaccine. You want to go to kingcounty.gov, find a clinic, and there, they're going to list all the great locations. A lot of school-based health centers are going to offer free vaccines for anyone under the age of 19 related to COVID. But there's no costs, and there should never be a cost for children and teens when we talk about the COVID-19 vaccine here in Washington. All right, I'm just gonna skip this for a second. Is it safe to get the COVID shot and the flu shot at the same time? This is a question I'm still getting today when we were out there talking to folks. And the answer is yes, it is definitely safe. You can get both of them at the same time. You can space them out if you like. It really just depends on your preference. If you want to avoid separate appointments for vaccination, get them done at the same time. if you know historically that your flu vaccine kind of tires you out, and the COVID vaccine may have done the same thing, you might want to space them out so you're not, sleeping all day or whatnot. But you really have an understanding of your body. And if anyone is new into the vaccination world, I would probably recommend, getting the flu, waiting a week and then getting the COVID-19 vaccine, as they're not used to vaccines in their bodies. So don't want to, double whammy them right at the start. But it's totally doable, it's totally safe. And we have been recommending that to folks just because time is important. Life is stressful, and we might as well do a 2-for-1 if we can. All right. So questions about the COVID-19 vaccine, you can call the Washington State Department of Health. There is a phone number listed on this webpage. You could call 211. You could reach out to me personally or anyone, a lot of people here at Public Health, folks that you've seen in this call before. But I'll stop there for a hot second. Does anyone have any questions on COVID vaccine or pretty much anything? All right, we're gonna keep cruising. All right, so this is gonna be some brand new kind of updated information. It's around the oral antiviral medication. So we had some changes to COVID-19 medication distribution. So the oral antiviral medication, a lot of folks are going to know it as Paxlovid. That's the one we've often talked about, and we're seeing doctors, prescribe for folks. They're often used to treat COVID-19. As of November 2023, most pharmacies and clinics had to start purchasing this medication. The way that antiviral COVID medication kind of worked was the same as the COVID vaccine. The government bought a big lump sum of all these vaccines and was waiting until that stockpile ran out before we started charging folks. And this is kind of where we're at with the antiviral medication. That big stockpile that the government had of free antiviral medications around COVID have kind of run dry. So there's becoming a cost to it. So this is just going to change a little bit. And it may impact, what you're kind of paying for it moving forward. And I'm going to kind of highlight that a bit here. But it is free for some folks as well. So Paxlovid is free for U.S. government patient assistance if you are uninsured or if you receive health benefits like Medicare, Medicaid, Veterans Affairs, or Indian Health Services in Washington State. Apple Health would be included in this as well. So that's just where you're going to still see that free Paxlovid or oral antiviral COVID-19 medication. If you have private insurance, Paxlovid or other antiviral medications, they might cost a little bit more. It's going to be really dependent on your insurance, and everyone's insurance is all different. I don't actually have a good understanding or even know a price point of where this kind of starts at for folks. Maybe next call I'll have a little bit more answers for you. I just got this today, but if you can apply for copay savings, we have attached this in the PowerPoint. It's paxlovid.com/Paxis. And this is just going to be for folks, exploring how they can save costs around Paxlovid if that cost just is a little too high. Again, I don't know any raw numbers of what that cost could be. If anyone does, please put it in the chat. I would love to know. But those are some of the immediate changes that we're seeing here is around that antiviral medication. So they used to be completely covered, and we're not having that anymore unless you are uninsured, underinsured, Medicaid, Medicare, Apple Health, Veterans Affairs, or Indian Health. All right. Another thing that has kind of silently started up, I believe, it's been around for, I think, a couple months now, but it's free telehealth for COVID treatment. So you can get free video health consultations from the Washington Department of Health. So from the DOH, they have a COVID-19 telehealth program. If you have mild to moderate COVID-19 symptoms, and that's important. If you have severe COVID-19 symptoms, we're going to want you to see your provider. We're going to want you, to go into your doctor's office so they can, physically assess you and what the next steps would be for your care and just in well-being. But if you have mild to moderate COVID-19 symptoms, this telehealth from the Department of Health is a great resource. You have to be 12 or older to access this. And you have to be high risk for severe disease or have certain medical conditions. They've been very lenient on this. A lot of folks fall into this bucket. They're not coming down with a hammer of making sure that you are, have these certain medical conditions. It's just, I guess, some part of their fine print. But I've had clients use this telehealth, and we've seen some great results, especially when we were talking about getting the antiviral medication. This Department of Health telehealth program for COVID-19 was able to get them a prescription right then and there, and they didn't have to, schedule a doctor's appointment or wait for their own telehealth appointment, to have a time slot. So folks didn't know about this. There's going to be more information on the next page, but we're going to send this in the PowerPoint. And this is definitely a good one to tell community about, because I feel like it kind of just like dropped very quietly. They didn't kind of advertise it a lot. So let's see if I can change the page. This kind of just highlights, what you're going to do when you go to the website. So you get the free video health consultation from the DOH. You're going to start your free video consultation by clicking on the DOH's website. And if you just have any questions or you need to complete a questionnaire, there's a phone number there. And this is important for digital access reasons. A lot of things that we've been doing, especially in this new normal, have been very online heavy. It's inclusive to people who have internet, who are able to use or have access to a computer and all that jazz, or have someone in their life that can, help them get them set up for this. But there is a phone number for this telehealth program as well. It doesn't have to be completely on a computer. There is a phone way to get about it. So I think that's important. A lot of things that we do, vaccines.gov, everything's online. And it's not easy for folks. So that phone number is an easy alternative. And again, I will bring it back to what we do here at Public Health. We do have teams out there that can help facilitate these types of things for you. So the community health workers is a great one that can help you, walk through these steps and get you the access and the care that you need. So if anyone is experiencing anything, you need help out there too, don't forget about me. Please reach out and we'll find someone that can help you and your community members. All right. So we got about 15 minutes left. I might skip through a couple slides here that I feel like we've kind of done before. But this one I'll go over very briefly. Are the COVID vaccine doses for kids the same as for adults? So the answer to that is no. And this is just important because of what we know it does to our body when we take it. Some people get really tired. Some people don't have any symptoms, but the doses for children is going to be a lot lower. You'll see them highlighted here. We have Pfizer and we have Moderna. They're very close to each other on their doses, but there is some difference there, but they are not the same dose that we as adult get. So anyone under 5 for Pfizer and anyone under 6 is going to get just a little bit smaller of a dose for just their smaller bodies. All right. Pardon me here, everybody. All right. So where to get COVID tests? COVID tests right now can be bought at pharmacies. They can be ordered from us here at Public Health if you're a nonprofit. And that's actually, just to kind of pause for a second, if you are a nonprofit organization and you are looking for COVID tests, if you could direct message me with your email, I could send you a link after this meeting where you can order COVID-19 at-home tests. We do have some still that we're looking to get out to community, but please just send me a direct message with your email And I can forward you that link after this meeting for you guys to order some, and they're free of charge. They just have to be delivered to business address. But back to the COVID test, you can get them at doctor's offices, pharmacies, CVS's, Walgreens, health clinics, a lot of various events throughout the city. I saw someone in the chat right now that says some Seattle public libraries have free COVID tests available as well. Libraries are a great resource. They are often cold shelters as well. They have access to the internet, restrooms, and free COVID tests, which I did not know, but thank you so much for that, Laura. You can also order your COVID test from the government on USPS. They will deliver them to your house. I believe you get one per household every 2 months or something along those lines. I don't remember the exact details, but there are still ways to access free COVID tests. If you do not have a free access around you, some insurance companies are paying, full price. So it means you'll pay nothing for a COVID test if you go to a pharmacy and get it, you go to a Kaiser and get it. But we are seeing some costs, some insurance companies not paying that 100%. So some of the costs are going to be, $11 copay, $20 copay for 2 to 3 tests. So again, if you're a nonprofit and you need access to COVID tests, please send me a direct message and we'll be able to help you out. All right. We're going to take a break from COVID here. We're going to talk about other resources kind of going on in the county. We have a program that has been running for years now at Public Health. It is called WIC. It's an acronym, but it stands for Women, Infant, and Children Nutritional Program. So at the Public Health Center, they offer kind of the classes. It's a referral-based program. If you are any of those acronyms, women, infant, children, and you need access to anything baby related, food, diapers, courses, rehabilitation things, this is a great program for you that they're doing at the Public Health Center. This is a tongue tie for me. You just have to live in Washington State. You have to be pregnant, a new mother, or have a child that is under 5 years of age. So there is income guidelines to this as well. But for folks that may fall into this bubble, this is a great resource, and it's a great place to network and meet folks as well, especially when you're that new mother or have children under the age of 5. So I kind of wanted to give a shout out for the WIC program and talk about some other things that are going on at the Kent Public Health Center here in Seattle. So a couple of the other things that they do at the Kent Public Health Center, we have a lot of health centers throughout the county, and I'm kind of highlighting the Kent one today. I think next meeting I'll highlight some of the resources at another location, but we're zoning in kind of on Kent right now. But they offer maternity screening, pregnancy tests, birth control. They have an STD clinic. Some of these offerings that they have specific times and hours. So the links that you'll see in this PowerPoint and also our website are going to kind of highlight those. For instance, they're not open all the time for, STI related things. They might branch more into that, so that WIC conversations and meetings that they're having, but they have emergency contraceptive, children with special healthcare needs. They offer resources and help around Orca Lyft, reduced, which is the reduced transit fare. Pardon me. And they also offer one more thing, which I think is very important, is a teen clinic. So this is at the Kent Public Health Center again. They have walk-in hours. They're every first and third Wednesday of the month from 1 p.m. to 4 p.m. It's a safe space. You could talk to them about anything. Talk to them anything about health related stuff. You can play games there, prizes, have snacks. Excuse me. And it's dedicated to just teen services, and it's confidential. They have STI testing and treatment, And if a teenager is 14 years or older, they do not need parental consent. If they choose, to not have that as well. So a great resource, a lot of great things happening at the Kent Health Center. Just kind of wanted to highlight those if you're not aware of some of the things that our health centers are doing. All right, so another something that's happening here at Public Health, or just at the county rather, is our mobile medical care for folks living with homelessness. So you're living on the streets, in a camp, in a vehicle, in a shelter, you're in a transitional housing period, you've been homeless in the past year. This mobile medical program is designed for those individuals. There's doctors and nurses, pregnancy tests, birth control, STD, HIV, hepatitis C testing, substance control, naloxone, which is like an overdose prevention. They have doctors that can follow up with you, and pardon me, but this mobile medical team kind of goes throughout the city, and they have a schedule, which I'll post on the next page. But if you work with folks living in this and you're not aware of this, this is a great resource for them. And if you are aware of it, I'm sure you know all the wonderful things that they've accomplished. A lot of the mobile medical team right now too is down in Riverton and Doubletree for folks who may be familiar with what's going on down there. And here is the schedule for the Seattle Mobile Medical Clinic. There's a link on the top left of the page. They released their schedule for the month about a week before the month ends. So a week before January ends, they're going to release the schedule for February. Nonetheless, here is the schedule for January. So you'll see it's kind of started on January 2nd. We got dates all throughout the city leading up until January 30th, which is the final day. Various locations, hitting the north, hitting the south, hitting the central, hitting the east, where the Seattle Mobile Clinic will be. So if you have any questions on that, I can get you connected to anyone on our mobile medical team, or brochures or anything that you might need. Please don't hesitate to reach out. I know I did talk about naloxone, which is the overdose prevention medication. So it is something that we offer here in the state of Washington for overdose prevention. If you are someone that would like to, to get naloxone for yourself personally, there are links on this page here where you can order it online and it will get mailed to your house. Pardon me. There's also ways that you can order it for your nonprofit. You can have educational material sent to you to kind of teach about the importance of having naloxone, or just the importance of overdose prevention and overdose conversations. A lot of times when we talk about overdose deaths, there is a stigma within community. King County has seen a rise in overdose deaths in the past 2 years, past 3 years, really. 2023 was one of our worst years yet for overdose related deaths. I don't have the exact numbers, but I believe halfway through last year, we had already had the same number of deaths as the whole total of 2022. Hoping that we could kind of curb that this year. But it is an ongoing issue. So any type of resources that you may need for your community, or you want me to talk a little bit more in depth about overdose conversations, preventions, statistics, anything, we have a whole team behind us that are willing to talk and to train around this. And I know it does come with a big stigma, especially in a lot of communities. It's things that people don't want to talk about it. It's things people don't think could happen to their own family, happen to their own friends, even though sometimes it does happen in your own backyard. So I will kind of leave it there. I just see one message in the chat. All right, perfect. Yep. Thank you, my friend who needs the COVID test. I will reach out to you and I will get you that link. But that kind of wraps up our meeting today. I feel like I was talking rapidly fast. So I apologize for that. But our next meeting is on February 14th, 3:30 to 4:30 p.m. We pivoted our calls from an hour and a half to an hour. Yeah, please, you see the email down below, phpartnerships@kingcounty.gov. Open to any and all suggestions about how to keep this conversation going and, pivot the way that you want it to pivot. So I want to thank you all. I want to thank all the interpreters as well on this call for helping out. So, yeah, have a good rest of your day, everybody. Stay warm out there, stay dry.
Hey, Justin.
Take care,
Hello.
all.
Justin, can you hear me?
Cynthia, how are you?
Hi, I'm good, thank you. I have a quick question for you just before we sign off. Everybody doesn't have to stay, but I have a family who signed up for health insurance on the Health Finder thing,
Sure.
and then found out that their current doctor that they've had for 5 years doesn't accept that insurance.
Interesting.
And so I'm like, do they get to choose another insurance? What would be my direction for them?
Yeah, I personally am not going to be the one to answer that. However, Giselle came to our last meeting. Giselle and Daphne Pye run the CHS.
Oh, I think I have her contact information.
Okay, I can make the introduction for you, or you can do it, but they're going to be the ones that will be able to answer any and every question around health insurance. And they'll know exactly what to do, and they will get back to you promptly.
Okay, so please, can you make an introduction? It's very important because
Yep.
they're in need of seeing a doctor now and kind of stumped. So that would be great.
Perfect. Yeah, I will get on that.
Okay, thank you so much. That's it.
Thanks, Cynthia.
Okay, bye.
All right. Yeah. So thank you, Manny. Thank you, Cheryl, Haji, Sheeta, Claudia, Gabriella. Thank you all. I will see everybody in February. Bye, everyone.